Hey, everybody. Good evening. This is Nurse Eunice, and I have missed you, ladies and gentlemen. As we do in each of our videos, we'll give you about 10 seconds to receive your notification. So let's join night nurse, excuse me, night shift with Nurse Eunice. Hey, Rosina. Make sure you can hear me. Can you hear me okay, everybody? I hope you all have been having a great day. Hello, Okafor. How's your week been? And Rosina, how are you? Yes, thank you for letting me know that you can hear me. Hey, Sheila. All right, and so sorry for starting a little bit late. I see Anna and Shanova and Sean. So yeah, we started a little bit late this evening because I've been having the hardest time. Oh no, you didn't pass your test. It's okay. It's okay, Anna. It is okay. You have additional attempts to pass your examination. So you get more than one attempt. What did you learn from the test? Like, what would you do differently if you had to take this test all over again with knowing what you know now? And so we're going to focus on the positive. There are a lot of people who don't pass their exams on the first time. You have nerves. It's a lot to learn. So breathe. You're going to do better this second go round. Hi, Merlene and Laura and Saka. So everybody, what's been up? Let's celebrate. Thank you for coming. Yes, yes. Well, I hope that you have an awesome shift at work. You only missed one. It is okay because you're going to be able, once you become a CNA and then a nurse, you're going to be able to encourage so many people because you were so close to passing. I'm sorry, it was just that one, but you're going to do it this time. You're going to knock it out the ballpark. I know for Prometric, you have to wait 30 days. So you have 30 days to study, to review that content, to learn that terminology, and you're going to do well. Hey, Labora. And then Anna says, tomorrow you have your skills. So I know you're going to do it. You can do it. And don't let what happened yesterday or today, whenever you failed your written test, don't let that, deter you from passing your clinical test. I know you can do it. Oh yeah. Miss Loretta, we talk about it. She failed her CNA test on the first attempt. She's our CNA instructor. And again, it's nerves. It's a lot going on when you take your exam. All right, Natalie has her exam on the 13th. Yes, we're wishing you luck. And let's see what Anastasia says. I passed my CNA exams. Whoop, 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 whoop. Anna, you're going to get the same energy when you pass your exams. I am so proud of you and congratulations. And you're beautiful. Send me that dress. And that's right. Sasna says good luck because we know you're going to be able to pass your test. Christina, hi there. Hello. And so let's see. Anybody else pass their exams this week? Anybody get accepted into nursing school? Anybody get a new job? Let's celebrate your wins and your accomplishments. And then Florence says it's her first time here. Hey, Florence. So Florence, I had a new CNA video because a lot of my students, they love the CNA practice questions. I had a new video that came out on Saturday. So if you go back and you look at our playlist for live videos, you're going to see a live video that came out on Saturday. Tomorrow, we're going to be doing 100 multiple choice practice test questions for the medication aid examination. And so whether you know it or not, in some states, Florida is one. Once you've been a CNA for a year, you can go back and take a medication tech class. I don't offer the class, but I help you pass that test. And so with your medication tech class, you can pass medications in nursing homes and assisted living facilities. And so that's a way up without going to nursing school per se. So 100 practice questions to help you pass your med aid exam. That will be tomorrow. Hold up. I see a lot of comments. Hello, Rosalore. I think it's Rosalore. Let's see, Christina, and your videos out. You're so welcome. And looks like Katie passed her exam. Whoop, whoop, whoop. Katie, where are you located? Congratulations. And then Shanova, welcome. Your first time here also. And let's see what Morris says. Morris says, I'm currently a nursing student in school in Trinidad and Tobago. Beautiful area. And I know you're going to do so well in nursing school. Plus, you're a male. Do you know that male caregivers are in demand, Morris? So, thank you for joining and being a part of the medical field. I passed my CNA test in Florida last October, took a job in Alaska. Girl, don't bring that cold weather back with you, El Renee. Elrena, I'm so proud of you. Sasna's for Texas. So, yep, and you take your exam on the 12th. Good luck. We get a lot of our babies from Texas who pass. Katie's in Naples, and then Esther is her first time here. All right, and so it looks like we had about 4 folks who passed their examinations. We have a couple of people whose tests are upcoming, and you all, we're going to do some practice questions in a few moments. Does anyone have any questions about nursing school, about anything before we start our practice test? For two, hi, I miss you too. Missed y'all last week. I did. And tonight I almost overslept. I have to get me a nap because running the business and then trying to get online, it takes a toll. Do you have a bundle of CNA questions? I do. It's on nurseeunice.com, but also Okafor, whenever you go there are free practice tests too. So you don't have to do the nurse bundle. So I'm going to put it in the chat. It's nurseeunice.com. And so if you don't want to do the CNA bundle of questions, just scroll down to the bottom. It's going to say free prometric and NNAAP practice test. And then I also threw in one of my personal practice tests in there. That will be free of charge for you. All right. And so let's see. I feel better. Yeah, the heat was 114. Yeah, it was hot. It was hot, really hot here in Florida. All right. So let's get started. All right. So let's see what has happened for me this week. Y'all, it's been so much good stuff. It's tiring, it's exhausting, but I love what I do. I love being a business owner. Oh, I got my own TV show that's coming out. That's what it is. Yeah. My son turned 13 this weekend, so we went indoor skydiving. So it's just a busy time, but it's good being busy. I'd rather have a business that's busy than a business that's the opposite. And so is being long time but am reviewing the video. Yes. All right. So we're gonna I'm having a few issues as usual with this tech, you all. It's hard to be a nurse and a techie at the same time. But we're going to do about maybe 15 practice questions. This is the test that we did over the weekend on Saturday. And so if you weren't there to watch it, or if you didn't watch the replay, you can go ahead and answer a few questions now. If you did watch it, that means that you should know the answers to this. And this is just more confirmation. And there is one of your practice tests, nothing different than exam. You know, I keep hearing that. I'm sorry, you all. I've covered like every question. So there's no reason for y'all to fail this practice test except for nerves. Okay. Or excuse me, fail your CNA test, because a lot of the questions, I hear that from a lot of students, that they were very similar to what I have on these practice tests. And then for two, she passed the CNA exam, the skills. So very good. Some states you do it separately. You do your written test and you do your skills. But in Florida, we have to do both on the same day. And then Simone says, hello, Nurse Eunice. First time on your live. Hi, Simone. Always watching your videos. Currently in the MA online class. I live in Jamaica. So thank you for joining. All right, let me figure out how to share my screen so that I can actually get you all to these practice questions. So once I'm sharing the screen, you all will not, I won't be able to see the chat, and I do apologize. All right. Let's share the screen. Let's do the whole window. Bada boom, bada bam. Okay, let's do that. Uh-oh. I'm trying, y'all. Thank you for bearing with me. Trying to be a nurse and a techie is not for the faint of heart. So thank you all for loving me, regardless of my tech skills. Let's see. I think this is it. Let's share audio and let's share. Fingers crossed. Fingers crossed. All right. Tell me what you all see. You see a practice test yet? It did it again, you all. It is not cooperating. look into our Canva account where we make the magic happen. So let's see if I can pull everything up here, get you all some practice questions. Is coming. I had to figure out a workaround. Questions. I'm looking in the chat now. Let me go to my phone. Can you see the question? So, question CNA: measure a patient's height in bed if they cannot stand. Is it A, use a tape measure from head to toe? B, use the height on a patient's ID bracelet? C, ask the patient to guess? Or D, use the height listed in the chart? And I'm going to go to my phone so I can see the exact same thing that you all are seeing. Listed in the chart. Okay. Looks like Okafor says that she can't see the question. Can you see it now, Okafor? Because I can see it. I have a TV next to me and I can see it. All right, looks like Fatu has given me an answer. Anybody else? Can you give me an answer? Sheila's giving me an answer. And then on my end, annoying commercial just popped up, but bear with me. All right, and so for everybody who chose A as in apple, you are correct. So whenever you have a patient who is bedbound, you're going to, as much as possible, lay that bed flat. In a perfect world, you'd be able to lay the bed totally flat, but of course, we're not dealing with perfect people. We're dealing with people who have health issues. And so lay the bed flat and you would have a measuring tape and you would measure from head to toe. And so that's how you would actually obtain a height measurement on a patient who is bedbound. So great job, team. I see a lot of answers coming through. All right, I didn't really care for this question. All right, so before taking a manual blood pressure, the CNA should do which of the following? Is it A, inflate the cuff to 300 millimeters of mercury? B, elevate the patient's arm above the heart? C, ask the patient to hold their breath? Or D, ensure the arm is at heart level and relaxed? I see a lot of answers coming through. Great job, team. Great job. Yes. It is D. Ensure the arm is at heart level and relaxed. So the way you're sitting right now, if you're sitting up in a chair, you want to make sure that the arm is at heart level because proper arm positioning is critical for accurate readings. Let's go to question 16. All right, looking in my chat. And I see that we have some of our leaderboards. We have Okafor at number 2, or for 2 at number 3. Looks like we have, I don't know who's number 1. Sheila, you're number 1. Great job. So which is a correct action when performing oral care on an unconscious patient? Is it A, use mouthwash with alcohol? B, use a tongue depressor to keep the mouth open? C, position the patient on their side? Or D, suction only if the patient coughs? And then the purpose of the QR codes is that if you are watching from television, you can point your camera app at the QR code, and then a link's going to pop up, and that link will take you directly to the video associated with the skill that we're showing on the screen. And so for question 7, we're torn. I see some C's, I see some B's. So yes, question 7, whenever you're taking care of somebody and you're doing oral care on someone who is unconscious, you want to turn them to their side. So it's going to be C, because the sideline position prevents the aspiration of fluids. Remember, if they are, make sure that our screen is caught up. Remember that if they are unconscious, usually they don't have a gag reflex. So you all give me a thumbs up if you can hear me okay. I'm going to refresh my phone here because I can't see any new chats. I need a thumbs up if you can hear me okay. I'm waiting. All right, I'm going to keep going. I think you can hear me. It could just be my chat feature. Yeah, you all can hear me. Good. All right. So, question 8. What is the first step in using a mechanical lift? Is it A, lower the patient onto the sling? B, check the weight capacity? C, plug in the lift? Or D, unlock the wheels? The first step in using a mechanical lift. All right, waiting for some answers to come through. And I'm sorry we have to do it this way, but for whatever reason, the system would not let me upload the slides to the streaming service. So we have to do it the old fashioned way. All right, let's see what those answers are. Revealing in 5, 4, 3, 2, and did you choose B? Did you choose B? If so, you are correct. So the first step in using a mechanical lift is to check its weight capacity, because if your patient is 500 pounds, but the weight limit or capacity on that device is 400, you should not be using that device on that patient. The facility would have to get a specialized lift for a patient who is morbidly obese. Question 9. When measuring urinary output from a Foley catheter bag or urinary drainage bag, what should the CNA do? Should it be A, pour it into a graduate container for measurement, B, empty it directly into the toilet, C, guess the amount, or D, document the amount as 500 ml if the bag is full? And I'm looking at this leaderboard. Let's see. Natalie right now is at number 1 with 75 points. And then we have Shay and Shashna, coming in second and third. And then Okafor, you're close to it. And for 2, you're number 5. So great job. Those are our top fans of the night. All right, and let's see. Question 9. What are your answers? Oh, we have a lot of A's. Let's see if A is it. And of course it is. And yes, we have a video on how to empty and measure the output from a drainage bag, aka the urine. Question 10. Too easy. This one's easy for you all, but we have some people, this is their first night here, so let's see if they can answer this one correctly. So a CNA notices that the oxygen tubing has become disconnected from the wall. What should the CNA do first? A, turn off the oxygen tank. B, reconnect the tubing to the wall oxygen outlet. C, notify the nurse. Or D, raise the head of the bed. All right, when you see me looking down, it's because I'm looking at my phone. I'm looking at the chat to make sure that your answers are coming through. All right, looks like I have a response from Fatu. I'm going to give a heart. I gave a heart. You all should give some hearts too. Only because I like hearts. All right, let's see what the correct response is. Revealing in 3, 2, and 1. You are right. It is B. You have to reconnect that. Yes, you're going to notify the nurse. However, you can't have the patient without oxygen for 5 minutes while you're waiting for the nurse to get into that room. So CNAs are trained to maintain oxygen safety. So if it disconnects, you can reconnect it. What you cannot do is adjust the flow rate. However, reconnecting the tubing ensures the oxygen flow resumes immediately. So you can reconnect. All right, this one's an easy one, so we're not going to do that one. For my newbies, question 13. When assisting a patient with one-sided weakness to dress, the CNA should do which of the following? Is it A, dress the strong side first? B, dress the weak side first? C, let the patient choose which side to start? Or D, remove clothes from both arms at the same time? Like they're a toddler. Raise your arms up. So it wouldn't be D because we're not going to treat our patients as if they're toddlers and this person has a weak side. So what are you going to do? How would you dress them? And so many correct responses. Yes, it is B as in boy. You're going to dress the weak side first because dressing the weak side first makes the process easier and less painful for the patient. That's too easy for you. All right, so a CNA is assigned to collect the stool specimen. What should they do first? Is it A, place the sample in a sterile cup? B, label the specimen container? C, give the patient a bedpan or use a collection device? Or D, store the sample in the fridge? What would be your, of these options listed, what would be the first step if you have to collect a stool specimen? And we'll try to do about 10 more questions before we call it a night. Oh, we're torn. I see some varying answers coming through. Let's see what we have over here. I see a B. I see a lot of B's. I see a C. And if you chose C, you are right. Good job, Sasna. So give the patient a bedpan or a collection device to use. So we don't label prematurely. We can't label until we actually have the specimen. How do we get the specimen? We actually have to get something to catch it. And so that'll be the bedpan, or they call it a hat. I hate calling it a hat. But so the first step in collecting a stool specimen is to obtain the sample correctly. This means the CNA must first provide the patient with a clean, appropriate collection device, such as a bedpan or a collection hat. It looks like an upside down hat. You place it towards the back of the toilet. Once the stool is collected, the CNA can then place it using a tongue depressor into your specimen cup. That's when you would label it. Some facilities make you wrap it with cellophane, and then you'd store it properly if needed. Label and storing only come after the specimen is collected, not before. And I know on both of our channels, we do have a video on how to collect the stool specimen. That one's going to be too easy for you. No, you all saw the answer, so I'm just going to tell you. When providing catheter care to a patient with indwelling catheter, what area should the CNA clean? And yes, it's going to be B, from the insertion site outward. So cleaning from the insertion site away from the body reduces the chances of pushing bacteria into the urethra. Let me not be so... All right, so here's one for you. Question 18. What is the correct position to place a patient in for eating if they are in bed? Is it A, supine, B, side lying, C, semi-Fowlers, or D, high Fowlers? Do you know the names of your positions? I'll give you about 5 seconds to answer this one. Let me check my phone. All right, revealing the answer in 3, 2, and this one got a lot of you all. It's D, is high Fowlers. So when you think of semi-Fowlers, they're reclining. That's about 60 degrees. You want to sit those jokers up because what happens is when you feed them in semi-Fowlers and they start to cough, and now you want to sit them up to 90 degrees. So we need to alleviate that. You want them sitting upright. You can put pillows behind them to support them, even if they're in bed, because having them close to 90 degrees as high Fowlers, it helps promote safe swallowing, and it helps to also prevent aspiration. So semi-Fowlers is more of a reclining position. That's before or after the meal. During the meal, sit them upright. All right. I know you all know the answer to that one for fall preventions. Question 20. What is the purpose of turning and repositioning a patient every 2 hours? Is it A, to reduce the risk of incontinence, B, to reduce the risk of aspiration, C, to reduce the risk of depression, or D, to reduce the risk of pressure ulcers? And as I indicate in each of our videos, if you hearing me read these questions to you it's helping you to understand the terminology, if it's helping you to answer the questions correctly, don't forget that when you take your written examination, you can ask for an oral test. They will give you an audio earpiece that will read the questions and the answers to you. And it usually does not cost you any more money. So if English is your second language, or if you're not too sure about how to pronounce some of the terms, I recommend that you take the audio examination. And yes, the answer is D. And of course, we got a video on that too. Pressure ulcer prevention is talking about how you as a CNA can actually do a skin check and reduce pressure points of whenever you're caring for a bed-bound patient. All right, so a patient is in contact isolation and they need assistance. What PPE should the CNA wear before entering the room? Is it A, gloves only, B, mask only, C, gloves and gown, or D, gloves, gown, and face shield? All right, what do we think, team? We got I want to say about 8 more questions, then I'll go back to the chat and see what other questions or what other topics you want to discuss. All right, so when someone's on contact isolation, it would not be D. It's going to be C. You don't have to wear a mask. So if they're on contact isolation, the answer is going to be C, gloves and a gown. Contact precautions requires gloves and gown to prevent the transmission through direct and indirect contact. All right. So a CNA is assigned to care for a patient under airborne precautions. So now we've went from contact to airborne. Which of the following PPE is required? Is it A, face shield with mask, B, gown and gloves, C, surgical mask, or D, N95 respirator? Let me check the chat. I see so many correct answers coming through. I need to see about 3 more responses. And when I see 3 more responses, I will go ahead and reveal the answer. Sheila said I didn't read it correctly. It's okay. And that is a good point, Sheila. When you take your written examination for your state exam, you can go back and review your responses. If you're unsure about something, you can also flag it. Someone asked me a question the other day and it was like, well, if I don't know an answer, should I leave it blank? Absolutely not. Because even with guessing, you have a 25% chance at selecting the right answer. Speaking of which, for 23, the correct answer is D. It's an N95 respirator mask. And so it is essential for protection against airborne pathogens like TB, and that means tuberculosis or varicella. And those usually you have to be fit tested for. So whenever you're in your orientation, they're going to fit test you. And so that way you'll know what size mask you need in case your patient's on airborne precautions. All right. 24. What should a CNA do before entering a room for a patient on neutropenic precautions? Is it A, put on a mask, gloves, and gown? B, wash hands and ensure no signs of illness? C, put on gloves and gown? Or D, double glove? For neutropenic precautions, so what's the correct answer? Hey, and if you stayed this long and you haven't given us a thumbs up, give us a thumbs up, like the video. Let the algorithm know that Nurse Eunice exists. Yep. Nurse Eunice and Florida Training Academy. And then hopefully in the next month, Miss Loretta will be coming on doing some practice questions and answers with you all also to give me a little bit of break and to help me start reaching out and teaching some of the practice tests for the nursing students. So if your patient's on neutropenic precautions, what does a CNA do before entering the room? And looks like, yes, for two, it is B. Make sure you're not sick and wash your hands. Don't even go in that room if you have a cough, if you are just getting over something, because neutropenic patients have weakened immune systems. Caregivers must be healthy and practice strict hand hygiene to prevent infection. So that's reverse isolation. We have that patient on isolation because we, as the caregivers, end up bringing them something, bringing germs into their room, that indirect or that direct contact. And then from that, they can get sick because their immune system is weak, such as those patients with who are on chemotherapy because they have cancer, or patients who sometimes have like long-term conditions that require steroids. Whether you know it or not, steroids over the long term can weaken the immune system. All right, let's go to our next question. All right, so you're caring for a patient and they are on droplet precautions. So we talked about standard, neutropenic. We've talked about airborne. This one's about droplets. You're caring for a patient on droplet precautions. Which PPE must the CNA wear? Is it A, gown and gloves, B, surgical mask, C, N95 respirator, or D, shoe covers? For droplet, and so whenever a patient's on airborne precautions, that means if they sneeze or cough, the particles are lightweight. They just float in the air and you can inhale them. When someone's on droplet precautions, that means they sneeze or they're coughing because their particles are heavier. They drop and they stick to surfaces. And so, but it still can be in the air for a short period of time. So if someone's on droplet precautions, you are right. You got to have on a simple mask, a surgical mask, but you don't have to put on that thick mask, the N95 respirator. So droplet precautions, AKA for things like the flu or COVID, require surgical or face mask to prevent inhalation of large particle droplets. Let's see, this one's going to be easy. All right, so a CNA is instructed to assist with passive range of motion, and we're going to go through 4 more questions. With passive range of motion, what does this mean? Is it A, the patient performs the exercises alone? B, the CNA guides the movements without the patient assisting? C, the patient walks in the hallway? Or D, the patient stretches using exercise bands? What does the term passive range of motion indicate? Go over here to my phone to see what answers you're putting in the chat. And for those 4 people who gave me a thumbs up on Nurse Eunice's channel, thank you. I'm trying to monitor 2 channels. I can't be everywhere at once, but I do try. All right, so let's see. All right, give me a different answer. If you chose C for question 27, give me a different answer. I'm not seeing any answers in here except for 2. So let me go to the other. Let's see if you're putting in something else. Oh, there are my answers. Let's scroll down. There we go. Oh my. So everybody, and for 2, I do apologize that my phone is not updating. It's not keeping up with everything. So you may have had the right answer, but my phone was stuck. So everybody, for question 27, the correct answer is going to be B as in boy. So with passive range of motion, that's what you have to do like on your exams when you have to support the person's arm and raise it and lower it 3 times for the state of Florida. And so you have to do those exercises in which the CNA is supporting the weight. That is passive range of motion. Whereas if you come into the room and you ask me if I'm a patient and you say, hey, Miss Eunice, can you raise your arm by yourself 3 times? If I can do it by myself, that would be active range of motion because I am actively performing the skill. So passive range of motion is done by the caregiver to maintain joint flexibility in immobile patients. All right, we got 3 more questions, team. That one will be too easy for you. All right, so all right. A patient with C. difficile or C. diff is in isolation. Which action by the CNA is essential when leaving the room? Is it A, use alcohol-based hand sanitizer? B, only remove gloves? C, place the mask in a red biohazard bag? Or wash hands with soap and water? So when your patient's on isolation for C. diff, what must you do when you're leaving the room? So this requires you to know what C. diff is. I'm gonna go back over here and check my studio because I'm having a hard time looking at it from my phone. Oh, so many D's. Maureen, Adama, Schneider, Merlene, Esther. That's right. So C. diff is that very foul, watery diarrhea. Large amounts can cause your patients to become dehydrated. But as a caregiver, because of the C. diff spores that are hard to kill, if you try to use hand sanitizer, that doesn't penetrate the pores. So you have to wash your hands with warm water and soap, and that friction is going to wash the C. diff spores down the drain. And so you would also have on gloves and a gown whenever you are providing care to a patient who's on isolation, contact isolation due to C. difficile. All right, this is important because there was a facility, I think it was up north about a week ago, and there was a fire, and allegedly the caregivers left, and about 10 of those residents, they did not make it. They ended up dying due to the fire, and some were actually also in critical care. So you all, for this question, there is a small fire in the kitchen area of a long-term care facility with multiple bed-bound patients. What is the best action for the CNA to take first? Is it A, try to extinguish the fire? B, close all fire doors to contain the fire? C, begin evacuating the entire building? Or D, wait for the fire department to arrive? A small kitchen fire, and you have multiple bed-bound patients. What do? And after this, we have 2 more questions. Let's see what my team says. My excellent caregivers were torn between B's and C's. Let's see. Let's see if we have any other. We have a lot of C's and we have about 3 B's. And so, you all, this is why I want to actually discuss this, because if it's a small fire and you have bed-bound patients, I need for you to close those doors. And so you have to know that the doors have a fire rating, which means that it's going to take an hour or 2 hours before the fire can cross that door. So when we say RACE is rescue, alarm, and contain, and or confined. So we close the doors to the hall. We close the doors to the individual patient rooms. That's going to prevent the smoke from coming through, or at least try to decrease it. And it's going to decrease that fire from coming through. You can't move 40 bed-bound patients at once. You can't evacuate everybody at one time. And so if you don't close the doors while you're evacuating one patient, the other 39 are suffering. So in a facility with vulnerable bed-bound patients, the priority is to contain the fire and protect residents from smoke and flames while ensuring safe evacuation can occur if needed. Closing fire doors is part of the RACE protocol. Rescue, if anyone's in immediate danger, aka the residents who are in the dining area near the kitchen, you move them, you rescue them. If you haven't already pulled the fire alarm, it would be a alarm. If you're in a nursing home, or if you're, let's say, in home care, you're going to be calling 911. That's how you're going to alarm. And then C, contain or confine the fire by closing off those doors. And E, if possible, extinguish the fire. Remember, with a fire extinguisher, you pass. You pull the pin, you aim, you squeeze the nozzle, and then you sweep side to side. So pass, pull, aim, squeeze, and sweep at the base of the fire. But if you cannot extinguish the fire, the other E would stand for evacuate. And so I hope that helped you understand fire emergencies, because caregivers should never leave residents at risk of, injury alone. And allegedly, that's what those caregivers did. How sad. Our last question of two. So this is our second to last question. A CNA is assigned to care for a patient who needs frequent assistance. Which action is the best example of clustering care? A, taking vital signs now and returning later to help with repositioning. B, assisting with toileting now and returning later for oral care and a linen change. C, given a bed bath and oral care during the same visit before breakfast. Or D, given a bath in the morning and brushing teeth after lunch. What is the best example of clustering care? Let me check our responses over here. All right, we have B's, we have C's. And if you chose C, you have it. Let's see who's in the lead. Let's check our leaderboard before we go to our last question. Looks like Natalie is number one, and then Shay and Sashna are number 2 and 3. And then Okafor was telling us he is at work. They're number 4. For 2, you're number 5. And Alta Grace, you are number 6. So thank you all for participating. Let's go to our last question. I'm going to kind of scroll to the back here. Let's see if we can get a good one. Oh, yeah, this is interesting. You enter a room and find that your resident is masturbating. The resident is alert, oriented, and able to respond appropriately. What should you do? A, scold the resident and tell them it's inappropriate behavior. B, immediately report the behavior to the charge nurse as an emergency. C, ignore the behavior and continue providing care. Or D, provide privacy and return later to complete your task. Let's see what you think, team. What a way to end the questions. All right, we have a lot of D's. Let's see if the D's have it, if they are correct. And of course you are, because you all are awesome caregivers. You're going to provide privacy. That person has a right to do whatever they're doing in their room. They're not hurting anybody. More than likely, you did not knock. You just entered that room. So sexual expression is a natural part of life, even for residents in long-term care. If the resident is coherent and not harming themselves or others, they have the right to privacy. The appropriate action is to preserve dignity by giving the resident privacy and returning later to continue care. Confronting, shaming, or ignoring the behavior without addressing the need for privacy is inappropriate and disrespectful. And so oftentimes, again, we entered that room without, let me end the screen share. I don't know how to end the screen share. Oh, crap. There, maybe we'll end it that way. So oftentimes what happens is, Sheila said, let them be. Oftentimes, can you all see me now? Just the slides. Are we still good? So if they're pleasuring themselves while you're in the room, yes, that is a problem. That's going to be something that you're going to get yourself to safety. You're going to exit right away. Go notify the nurse. But oftentimes we don't give them enough time. We just knock and we walk in. Remember, when you're taking care of a resident, that is their house. When you're taking care of a patient, that is their house. They're paying all that money for that room. And so you still want to give them the decency. Knock first, wait for them to acknowledge you before you enter the room. Now, if you knock and they don't say anything, then you're going to go in. But, at least give it maybe 30 seconds. All right. And so Anne says, one more, please. And I have this whole video. I did it on Saturday. There's an entire video, but I think that video has 50 questions. And in the video I have tomorrow, we'll have 100 questions. And so whenever you go to our playlist, you're going to go to the live videos, and this is going to be the most recent video. And it's pretty much the questions we just did, but I only did maybe 15 of them. You'll be able to see all 50. And of course, again, because it has the QR codes, you'd open up your camera app. You would, when you open up your camera app and you point it toward the QR code, a link will pop up. You'll click that link and you can see the skills video that correlates with whatever the question is. So let's see what questions I missed. What are your last question comments? Tomorrow, 100 questions, med aid examination, because once you've been a CNA for a year in some states, you can start giving medications. That's a very serious role. Wish you would go to nursing school, but right now they're trying to not pay the nurses all the big bucks. So if they're going to elevate a CNA, I'm all here for that, but go to nursing school. All right, you got questions? I may have answers. Are there any questions before we leave? I can't believe we've been here almost for 45 minutes. So any questions? All right. Well, if you all don't have questions, I'm going to go and check emails or something. So everybody, don't forget to like, share, and subscribe for more Night Shift Vibes. And so you all know how much I love you and I appreciate you. And you're going to pass these tests. You're going to pass these tests. You're going to pass these tests. And if your desire is nursing school, there are so many other avenues. You have speech therapy. Me and Miss Loretta, we shot a video and we were talking about one thing that AI can't do is AI cannot touch, it cannot care, it cannot hold the hand of someone who's in distress. And so you are going to have a job. You just got to figure out what type of job that you want. And then, of course, everything isn't for everybody. So don't forget about home care. If you're getting burned out working in those hospitals doing those 12-hour shifts, try to find something that's slower paced so that you can actually study and have time for your family too. And so that's how I'm going to end, everybody. This has been Nurse Eunice. I love you all. Good night.